All of us to get involved. We so appreciate that, Eric, and we thank you for all your hard work with this. All right, you guys have heard it now. The vision for the All of Us research program, it's clear, and the excitement and the hope that we have in the future of research and health is really palpable here in Detroit. As you've heard from the previous speakers here today, we are all here for a very important reason: to raise awareness about the All of Us research program and to encourage people throughout Michigan and all across the country to get involved with this program. We are fortunate to have our own Henry Ford Health System as one of the 10 healthcare systems chosen for the All of Us research program. Pretty exciting. And to tell us more about the program and why it's important and how we all can benefit from it, we have a distinguished panel of speakers for you here today. I'd like to introduce to the stage, they're right here for you, Dr. Adnan Munkara. He's the Chief Clinical Officer of Henry Ford Health System. Thank you for being here. Also, Dr. Suzanne White, the Chief Medical Advisor from the Detroit Health Department. Welcome. Dr. Christine Cole-Johnson, the Chair of Henry Ford Department of Public Health Sciences. And Dr. Richard E. Smith, the Vice President, Physician Outreach for Henry Ford Hospital. So thank you to the four of you for being with us. All right, we're going to start with Dr. Adnan Munkara. We will just let you take it away and speak for a couple of minutes.
Thank you, JoAnne. Good afternoon, everyone. It is so exciting to be here, and it is really an exciting day for me and hopefully for all of us with the launch of All of Us research program. On behalf of the Henry Ford Health System, I cannot tell you how excited and proud that we are will be one of the leaders of this program around the nation, chosen by the National Institute of Health, and will be able to partner with a group of distinguished institutions around the nation to improve our health. I would like to thank Eric Dishman for being here in Detroit today in the Ford Field, celebrating this for us. Thank you, Eric, for being here.
Yeah.
I also would like to take this opportunity to thank our own Detroit Lions organization for sharing with us this nice stadium today and sharing it with our community. What is All of Us? You've heard about it. It is really a significant effort for us to make medicine better, to improve our health, to drive us toward where we need to be, preventing and treating disease. We really believe that the data that will be collected over the next few years will be essential for us to understand diseases better, understand diabetes, understand hypertension, understand stroke, cancer. Not only understand them, determine how we can prevent them, how we can diagnose them early, how we can treat them better, how we can go and get from a point where we are treating this one disease the same for everyone, irrespective how diverse we are, to diseases when I go into my doctor's office and I will say, Adnan, this is your data, this is your genome, this is the drug that will work for you. And this is, I think, where we need to get. I've lost my father to brain cancer, and I have no doubt in my mind that in years from now, when we finish programs like this, we'll be able to manage and treat cancers and other diseases much, much better than we are now. We'll be able to treat the right person with the right medication at the right time in the right location. This is what All of Us will help us drive, and this is why we are so excited about it. And this is why we want all of you to be with us, partnering with us on this. All of Us is not just a research idea. It is really a community movement. We really need all to be involved. We need the 1 million lives to be participants, to volunteer. I have it because of my conviction that this will help change medicine. This will help change our health. And I would like to thank you for enrolling in the program. And if you have not, I would really like to kind of ask you to do it. I would like you to encourage your neighbor, your family member, your friend, your coworker to get in, and join the program. It is easy to do it. Go on henryford.com, join All of Us, and here you go. You can be part of the 1 million person movement to improve our health. Thank you for being here, and I hope you'll be one of my partners on the All of Us research program.
Dr. Munkara, thank you very much for that. I appreciate it. We're going to hear now from Dr. Suzanne White. And I know, Dr. White, you're going to talk a little bit about the disparities. Part of this whole thing is to kind of overcome the disparities in health research. And you want to address that a little bit.
Yes, thank you. Well, first I'd like to just offer, on behalf of the city and the health department, heartfelt congratulations to Henry Ford Health System and the NIH. This is such an exciting partnership. And I think the discoveries that I'm very confident are going to come out of this are going to really help Detroiters live healthier and happier lives. Each day working in the city, I face patients and community members who are really challenged by many different health disparities. And I wanted to just share a few of those with you. Beginning with our very, very earliest populations, nearly 14 out of every 1,000 babies in the city of Detroit don't reach their first birthday. So we have a significant problem with infant mortality in the city. This problem is 3 times higher than elsewhere in the state or the country. It really, the infant mortality rates in Detroit parallel those that we see in underdeveloped countries. This rate has not changed in over a decade. And so we hope to see amazing discoveries in this area to help our youngest community members reach their full potential. Another big problem that's occurring in the city over the past 5 years is we've seen the number of deaths from drug overdose increase by 5 times in the city of Detroit. And that reflects, in part, untreated mental health disorders or undiagnosed mental health disorders or substance abuse disorders. And that is another significant disparity. We are one of the cities with the highest burden of that particular condition as well. In terms of chronic disease in our older adult populations, for example, we have 3 times the rate of diabetes, obesity, and heart disease as across the state. And in fact, Detroit has been listed as one of the top 10 cities out of the 500 major cities in the United States as having a high burden of these conditions. In some of our Detroit neighborhoods, over 50% of people suffer from diabetes, obesity, and heart disease. That's 1 out of every 2 people in the city. So my belief is that research is a really powerful change agent. And it's not that very well-meaning individuals have not tried to address some of these disparities in the past. It's simply that we need to understand more, and we need to understand how we can uniquely diagnose and treat and cure some of these conditions. So with that, I have to echo what Dr. Mankara said. We really appreciate everybody's enrollment and encouraging your family, your friends, your coworkers to enroll as well. And again, congratulations.
Thank you so much, Dr. White. Before we hear from you two, we do want to bring up a couple people who have signed up today. We are so excited to have them come on up and join us here. We just want to take a second to talk to you because, as Dr. Mankara said, really the success of this is going to depend on the people who sign up and take part in this and are 1 of the million, or in this case, 4 of the million, or maybe more if you signed your whole family up. So first of all, thank you for being here. If you could tell me your name, where you're from, and why you decided to sign up.
Okay. My name is Christina, and I'm from Detroit, and I live in Dearborn. And the reason I signed up is because I battled cancer, and I survived it. And I think that because of research and programs such as this, I think that's going to help to make future medicine even better.
You've been in remission now? You're doing well?
Yep, I'm a cancer survivor, 5 years. I'm great.
Congratulations. Congratulations. It's wonderful. We hope that we can help people like you, and that's why you want to get involved, and we appreciate that very much. Let me step over here for just a second. What's your name, where you're from, and why did you sign up?
John Randall from Farmington Hills, and I just want to live a long, healthy life like my grandma just lost her, and she lived until 100 great years.
100 years old?
Yeah, just lost her.
Okay. I'm sorry about that, but what a life, huh?
Yeah.
Well, we thank you for taking part in this.
Thank you for having me.
We appreciate it. Thank you so much. Your name and where are you from?
My name is Bridget Knox. I live in Bloomfield Township. I work at Henry Ford West Bloomfield Hospital.
Great hospital, by the way.
So that's one of the reasons I signed up. And I had an older brother that died of brain cancer over 10 years ago, so I think it's really important.
There is so much research, particularly with brain cancer. I know it is just, I've got a good friend whose son has it, and the gentleman lost his wife to it, and it's just so difficult. So anything we can do to understand it more, right?
I agree with that.
Wonderful. Well, thank you for signing up. We appreciate it. Do love West Bloomfield Hospital. All right. And your name?
I am Bruce Johnson, and I'm from Livonia, Michigan. I'm a science teacher from training, and I've always stressed to the kids how important data is. I get to be a data point now,
Yes,
so
you do.
good for me.
That's right. You signed up today or are going to?
I signed up, yes.
Wonderful. Well, what do you hope to get out of it?
I hope to be actually a point of research. So, I mean, obviously, if they give us some results that we can benefit from now, that'll be a plus for us also. So,
Wonderful.
The precision medicine idea.
Yeah. Well, thank you to the four of you. We appreciate it. 4 of a million, right, you guys? Thank you all so much. Thank you. We appreciate it very much. It's going to take people like all of you to make a difference here, all of us, as a matter of fact. All right, let's get back to some of our doctors now. I'm pleased to introduce Dr. Christine Cole-Johnson. You are co-leading Henry Ford's group of health providers tasked for enrolling participants. So that sounds like a big job, because we're talking 1 million people.
That's right, it is a big job. And what we're trying to do, Detroit, is to take care of some of these problems that Dr. White just mentioned and make us the healthiest city in the country, right? Yes. And I want to thank people that came. I also want to thank, we have collaborators here from all the way from Minnesota, Massachusetts, Western Michigan and Grand Rapids, and Texas. So thank you for coming all this way. I've been a scientist for 33 years now at Henry Ford, and mostly working in allergy and asthma prevention and trying to figure out how to detect cancer early. And been on a lot of projects, but there's been none like this one that's so innovative and so novel. This, look at my glasses here. How would, a lot of people I see are wearing glasses or have contacts. How would you like it if we all wore the same glasses? It wouldn't work too well. These have been designed just for me, and I even got to pick out the color. That's what precision medicine is all about. We're going to try to make all of medicine as precise as our prescription glasses. And if we have this incredibly large collection of data and specimens from over 1 million people, just think of what we can do. Part of the problem with research is it's kind of slow. It takes a long time to find the people eligible for a study, and then you have to follow them up and collect a lot of data. In this case, the data is going to be there already. And scientists can answer all kinds of questions very quickly. You know, why a medicine works for some people and not for others. Why, maybe even what diet is best for you. And if somebody develops a medicine, a new one, we can figure out by looking at the database who would benefit from it and just contact them directly. This project, as was also mentioned earlier, is also different than anything I've ever worked on, because instead of considering the people in the project as subjects, research subjects, they're actually participant partners. And because of this, not only, usually when you're in a study, you never find out the results and you never find out your own results. But in this case, people will be offered their results back, even their genetics, if they want it. And they also are able to participate in this study and suggest ideas for the scientists to discover. They're also already working, in fact, there's people right here from Michigan who are helping to design the surveys, helping to get people involved in it, helping to design the study. So one of the goals of all of us is to really speed up science so that doctors and scientists can advance medicine in this country more quickly than before. I think that all the people in this big room are going to have somebody they know that will benefit from this. And in fact, it might even be you. But for sure, the children, the youngsters in this room and their children are going to really benefit from this. So, I joined. I got my All of Us thing here, bracelet. And I joined because I want to make a difference for the future. I know some of you have already joined, and that's fantastic. And if you haven't, I hope you will join and become part of this. Thank you.
Thank you so much. Dr. Christine Cole-Johnson, thank you very much. And lastly, I would like to introduce to you Dr. Richard Smith. For those of you who may not know, Dr. Smith is a longtime OB/GYN physician who has delivered generations of babies at Henry Ford Hospital. Now, you're not that old to deliver generations of babies. Anyway, well, thank you for your work and thank you for involvement in this. What's the message you'd like to share?
Well, I just want to thank everybody for the opportunity of just taking care of people in the city of Detroit for so many years, the trust that you've put in me and the families for the last 4 decades, going on 5 decades now of delivering. It's been a remarkable experience and sharing your lives with me. And I often tell folks that I learned calculus to the sounds of Motown. I learned biology to the sounds of the Victors, and I learned how to do surgery and deliver babies, listening to the music that the families would bring in while the mother is laboring there. And in doing so, you learned about the diversity of our culture, the diversity of our population here, and how every baby is so special and different as into this world. It's been an honor. As I mentioned, I'm from Detroit. I'm more in Detroit than anybody here. My grandfather's grandfather was born here in Detroit. Heck, in the end zone back there, I was baptized in the end zone there. There used to be a church there, St. Matthew's Episcopal Church. Hey, there's a plaque on the wall in the parking structure that talks about that. You can't get any more Detroit than that. And I believe in this community. I believe in the state of Michigan and the people of this country that all together, all of us can work towards this goal to achieve this success here. And I tell you that just a couple of just brief examples I'll give you. Representative Dingle was here earlier. We talked about how we met. We met in one of the churches when in the back rooms of different schools as we led that fight for infant mortality, how to provide prenatal care. It's called Baby Your Baby campaign. And we were able to do that. We were showed how you lower infant mortality. It became the law of the land recently, how women can get prenatal care. But it took all of us working together for this to happen. And it took places in the hospitals in Flint, in Jackson, Michigan, and Detroit, all of us working together towards that goal. Now, as we look across the room, everybody's kind of young here, but if you talk to your parents and your grandparents, they'll tell you about the scourge of polio had for this nation and to the whole world. But that was solved. That was solved in a laboratory not far from here in Ann Arbor by Dr. Jonas Salk. By everybody coming together, the school children, they walked, they collected dimes, the mothers, everybody pulled together. All of us here in Michigan did that with people from around the country. I'm very optimistic. I see no health challenge that we cannot meet. I mean, this is what we face. We do great things here in Michigan. So pulling together, we can conquer. We want everybody to participate. No longer should a woman have to go to a doctor's office with a small little breast tenderness and lump and says, you don't feel that algorithm, so we're not going to do any testing on your breast, and a 25-year-old dies from breast cancer. That shouldn't happen anymore. We should be able to identify the genes. That's right. That shouldn't happen. We should be able to find out, if all of us sitting in one row who have high blood pressure, we should be able to identify the modality of treatment for each and every one of you based upon the genetics and the environment that you're in. I see no health challenge that we cannot meet if we all work together. That's what this program is for. This is what we can do as a community here. I ask everybody to participate, sign up, and let's go forward.
Woo! I am motivated. Dr. Smith, thank you very much. Just incredible. And that's what it's going to take is all of us. I just want to ask you a few questions. We've got about 10 minutes left on this today. And I know some of this was addressed by some of the other national stuff that we heard, but I'd like to revisit it just for people. I think there will be people who will hear it and they'll say, I love this idea. This is so great. But gosh, I'm so scared about privacy. Eric, you talked about this. And we know so many steps have been taken. But if someone says, well, I don't want the government or the NIH to know my name and my this and my results of this. Can someone address a little bit more about the privacy aspect of that and try to allay any fears that someone could have?
I guess that would be me.
Okay.
Every precaution possible, everyone knows that is a concern, I think. In fact, it's a concern for me. I'm in the project. But I think every possible protection is being put in place. In fact, that's one reason it's taken a while. This has been in a pilot phase for a year, and the NIH wanted to make sure that everything was just so, everything was, right on, so that we wouldn't have any kind of breach. And there's also things such as that personal data is kept separate from research data, so that it can't be connected, which is what we usually do in research, as a matter of fact. So. I mean, nothing's 100% in this world, but I think it's 99.999 safe.
So your name is separate from the data that they're actually studying?
That's correct.
Okay.
And you can't see other people's data individually. You can just see yours if you so choose.
Got it. Okay. Good to know. Long term, what are you most excited about? What do you think that this project with 1 million people can perhaps have the biggest influence on? Is there one thing, or is that just an impossible question?
Well, the thing is, all of us are in, we're going to look at everything.
Yeah.
I think we just can't say we just want this one goal and that's it and go and sit on our laurels. We still have serious health problems, as the doctor pointed out. Still don't know why some babies are just born premature. We still don't know why some women get what's a disease called toxemia in pregnancy. With all the research that there's something else going on there. We still don't know why that infant mortality rate is high. Let's look at all the factors, the environment, the individuals, the genetics, the healthcare that's going on simultaneously. We can address that. We can't limit it to one. We want to look at all. That's why, again, I say all of us need to be all in for this, and let's go forward with this.
So, JoAnne, what this will provide us at the present time is the data to be able to launch thousands, if not hundreds of thousands of research projects in the future to address what we need to do. And what's great about this is the first time we are looking at so many factors, not only medical and health factors, not only genetic factors, but environmental factors, how we live, what we eat, where we are moving to, which apartments we are or house we have moved from and to. And this is what's going to make us be a healthier community and a healthier nation. Being able to understand all this information, pull it together, and see how we can use it to move and have healthier and longer lives.
Which is wonderful. That's what we all want. Certainly, let me ask, I think, Dr. Johnson, are you in charge of working with getting people signed up, correct? How will it be if I go to my OBGYN? Are there going to be signs up? Because if people aren't watching these telecasts and on Facebook and all this stuff today, how are we getting the word out to people?
There's lots of different ways that we are trying to reach out. So there's a national presence that you just saw start today, which I think will be very helpful in spreading the word. Locally at all different sites involved with us, as well as in other cities and groups, they're all doing their both social media and newspapers and things like that, and also through their clinics and friends and everywhere they can to try to get people involved. The website is one really good way to start out.
Okay, good. How about getting more than 1 million? Eric, can we get more than 1 million, do you think? 10 million. 10 million, all right. We'll start with 1 million, I know. We'll start with that nice round number, right? Does one of you want to address, again, I know we saw it earlier, but address the process of signing up. Is this really laborious, or is it a pretty easy thing to actually get involved in?
Okay, I guess I'll take that one too,
okay.
Or boots on the ground. It's not that difficult to be a part of this. First, you sign up. You have to do what's called an informed consent online that explains the project to you, so you'll know what it's all about. After that, you do some surveys. Now there's 3 or 4 surveys that don't take very long, 30 minutes or so, asking about your health. And then you need to go to a clinic visit. Some people will be asked to go there and provide a blood sample and a urine sample. And we expect in the future there will be other surveys for you to fill out, and there may be opportunities for you to do things like wear a Fitbit like this and have that connected up so that people can see how much you move around.
The other thing, for people thinking this is really laborious, and not just the signing up, but the process through the years. It's not like you're going to be filling something out once a week to be part of this program, correct?
No.
Okay.
I think we want people to stay involved and stay in touch, but every few months or so, or no more than that, people might be asked to do a survey. It's still in the planning. It reminds me, when I was a kid, when the moon shot, when we wanted to go to the moon, and we didn't really have the technology to go there. I remember this, and we knew we wanted to go to the moon, but we weren't sure how to get there, and we didn't even have the technology to do it. But I think this is what this is like, that it's this gigantic program to the United States, and we know where we want to go, and we don't even have all the technology, so we can't exactly predict what's going to happen, but it's going to be fantastic.
Dr. Smith, did you want to add something?
I just want to say I agree with you on that. You know, living through that and looking at the space race, it was an exciting time for our younger lives. The younger people don't have a clue about that at all, but it was a very exciting time. What's going to make this work also, when I say all, I mean all. We need people from diverse backgrounds, diverse ethnic groups, different regions of the country, different regions of the city to participate in that so we can truly get a perspective on where this is coming from. That's how it would benefit you. That's how it would benefit everyone in the city of Detroit, the state of Michigan, and this nation. So we got to get as many people involved in our smaller communities to participate this. There's a trustworthy side on that, and just come forward.
Wonderful. Does anyone have a question out here that you have that I could repeat so that people at home could hear? Anyone? Eric, did we not touch on something? What else do we need?
I think what they said was right. I mean, I called it a startup a little bit ago. And it's not that we're not planned. We have a plan for the first couple of years and a line of sight, thanks to Congresswoman Dingell and others who supported a bill called 21st Century Cure and funding for the first 10 years. But, you know, like somebody said earlier today, we didn't, or Representative Dingell said, you know, it wasn't that long ago we didn't have smartphones. We don't know what's coming out next.
Right.
But as we will grow with you as a cohort over time and really look forward to kind of inventing this and figuring it out as we go along. But, you know, it's pretty easy to do. I mean, you go to joinallofus.org. There are libraries around the country, clinics around the country, community partners who will be holding events. For many people who are not digitally savvy, there will be people that can help them get online and go through this process. Awesome. So, you know, I think it's a chance to be 1 in a million. If we find out that it's easy to do 1 million or easier than we thought because no one's ever done it, then we'll aim for 10 million after that. But let's get the 1 million first.
Let me get the question over here real quick. Lee Iacocca, research on diabetes, he referenced there. Don't know if not, I can have you come up and talk to them afterwards too, okay? Right there?
Yeah, that was my question.
Okay.
Because I heard it on radio maybe 2 years ago, and I read part of his book. It was fascinating to know.
Got it. Well, we'll try to follow up on that. You mentioned politics for 1 second. Debbie Dingell, I want to say one thing. I know part of how this all got going in the country, it passed the Senate 95-5. What passes the Senate 95-5, right? So we got everybody on board with this. Right. So that's a beautiful thing. You guys, we only have about 3 minutes left, but Dr. Smith?
Going back to what you said, you never know where you're going to end up in some of these sort of things. One process improvement will lead to another process improvement and things you've never even thought about. The classic example, I think, was Henry Ford when he came out with the assembly line in the Model T. He changed America as people began the Great Migration. And also during that period of time, it says he created the middle class. But one little fact and statistic for the city of Detroit, the infant mortality rate since the time of the assembly line in the Model T was cut in half in 15 years, just because of that.
Incredible. We don't know what can come out of this, but we know it's going to be incredible. It can really only be incredible when we see the wealth of information that we can get when we have 1 million people. All right, real quick question. You've got a microphone.
All right. So we talked a lot about young people getting involved. How old do you need to be to enroll, and are there enrollment for children planned in the future?
So there's no age limit. In fact, someone in the audience, my mom, is in it, and she's 89.
Woo!
Yes. But it is true that right now it's from 18 up. But in the near future, in the next year, I'm actually on a committee that has to organize the recruitment of children from birth all the way through 18.
Wow.
And that is definitely planned, should start up in 2019.
Wonderful.
We need to study kids too.
Yeah, absolutely we do. Well, we want to thank the 4 of you. The doctors will be here, I'm sure, off stage. I just signed you up. For just a second, if you have a question, go easy on them. Eric is here as well. I do want to thank all of you in the audience here and all of you at home for watching this as well. On behalf of Henry Ford Health System and the National Institutes of Health, thank you for participating in the All of Us research program. Thanks to the 4 of you for taking the time and being so passionate about this. We know that great things can come of this, and we thank you for sharing your message today. So we have a minute left, and in the minute we have left, you guys, I need to tell you that if anyone's still here, there's prizes that nobody has claimed. So I want you to know that that there are wonderful passes. Should I do this, you guys, during this, or maybe, okay. Real quick, 919-375. If you have that number, you've won 4 zoo passes. $50 Amazon gift card, 927-220. And I will stay up here with these numbers, okay? Pocket Watch Shinola, 919-605. A $50 Amazon gift card, 927-635. 4 Tigers tickets, 928-783. And 920-162. And finally, tickets for FC Soccer, 919-357. I have the list up here. If you have one of those numbers, please come on up. You can get your prize at Gate G. Thank you, all of you. We hope all of you will consider signing up for the All of Us Research Program. Thank you for watching today. Be a part of the future of medicine. And again, to all of you doctors, thank you so much. Have a great day. Safe travels, everyone.